Hey guys, Dr. Sarah with Balance Within Physical Therapy here. I have also been getting a lot of questions about MRIs and x-rays and do I need those for my back? And oh my gosh, my MRI is showing a disc is bulging. What does that mean? What should I do? I just wanted to put out this video to help give some reassuring information about what the research and the studies really show on this. So there have been tons of research studies replicated in all the major medical journals showing doing MRIs on people that are healthy ages, middle-aged to older, and no pain. What they found was roughly half of them had some discs bulging at different levels of their spine and had no symptoms from it. So what we know is that you can have discs bulging and these things happening and not have pain from it. So oftentimes, unfortunately, when we get MRIs or these different things showing that there's things going on with the discs, we rush to conclusions and think, oh my gosh, this is where the pain's coming from, like I'm doomed or things like that. But no, like those findings are totally normal and it doesn't mean that that's where your pain's coming from. In these same studies, they've taken the same people, repeated the MRI 6 months later, and in a bunch of them that had disc bulges happening, they resolved on their own. So just know that, there's the vertebrae in the spine that stack one on another. There's the discs in between. They use the analogy of like a jelly-filled donut. So, they're supposed to have some give and to be able to change shapes. They're part of our shock absorption system to our spine. So it's normal for the shapes to change and to ebb and flow and things like that over time. Our discs also don't really get a lot of innervation or nerves to them. So more commonly, the pain drivers tend to be tight connective tissue or fascia, tight muscles. Sometimes there can be a nerve pinched, but it's not always pinched at the spine. It's very common that nerves can get squeezed down with tight muscles and tight connective tissue too. So really what we find is most, and the research backs this, that they don't recommend rushing into imaging if you're having back pain. They really recommend going and trying physical therapy for a handful of sessions and seeing if that can get you better, because 80-90% of the time or more, that's all that's needed is just restoring normal motion and alignment and strength and loosening up the muscles and that tight connective tissue or fascia, which is one of our specialties. So you can save yourself the big MRI bill and things like that. Try PT first. I totally recommend that. It's, a huge way to just get you back to doing all the things you love, hiking, biking, playing outside in the beautiful summer months, and not having to spend a bunch of time and money in the doctor's office. So if you'd like some more resources or some more information, we have free guides, all sorts of blog articles and exercises you can try on our website too. You're welcome to learn more as well as to claim a free consult with us to pick our brains. We're happy to help you start troubleshooting things at www.balancewithinpt.com. All right, thanks so much, guys. Take care.